We have held this morning frozen shoulder, aka painful stiff shoulder, and there is no better person to talk about that than a friend of the house, Dr. Olatubi Olawale, a physiotherapist with his forte in sports medicine and orthopedic rehabilitation. Great to have you, Doc. You're welcome.
Thank you very much.
Been a while.
Yes.
Okay, so what do we call it now? Stiff. What's it now? Frozen shoulder. Why is it called frozen shoulder? What are the symptoms of that particular ailment, or as it were?
Okay, a frozen shoulder actually happens to the shoulder joint,
Okay.
and is characterized by stiffness of the shoulder. That's restricted range of motion of the shoulder joint. Now, the shoulder joint is a very complex joint. It has muscles surrounding it, it has ligaments surrounding it, and it's one of the most movable joints in the body. So, so you have flexion, extension, circumduction, we have abduction, abduction. So it's a very movable joint. So when there is stiffness and painful joint, stiffness when it comes, you cannot move your joint past this level, then it's called frozen shoulder.
Frozen shoulder. Causes?
Now, frozen shoulder can be primary, it can be secondary. The primary cause can be as a result of diabetes. People with diabetes actually are prone to having frozen shoulder, and people with Parkinson's are actually prone to having frozen shoulder. Also, people with thyroid disease are often prone to having frozen shoulder. That the secondary cause actually can be as a result of post-injury to the joint. Probably you've had an injury to the joint before, it's healed, and probably when you were treating your joint, you didn't properly move the joint. You are prone to having that frozen shoulder. Also, it can happen to people with stroke, that had stroke, post-stroke patients are prone to having frozen shoulder. Then if you had a tear on your muscle, because we have a rotator cuff muscles around the shoulder joint. So if you had a tear before and it healed up, you are prone to having this stiffness of the joint. And the stiffness is characterized by you not being able to move past a level, both actively and passively. Example, now if I tell you, Mike, move your shoulder joint up like this, and you can able to move it, but it's stiff like this. And I even try to move it for you, and it's still stiff.
Okay,
Then
so that's passive now.
That's passive now. When you do it yourself, it's active. When I do it for you, and it still can't go past this level.
Wow.
It's still, that's what we call frozen shoulder.
Wow, wonderful. And I found out that also, before we get into the treatment and all that, I found out that the shoulder is also about the most used joint when you're working out.
Yes, it's the most movable joint in the body.
Most used joint in the body, because
use
a lot of when you're trying to build the upper body, you basically almost cannot do without your shoulder. It has to be involved in almost every form of exercise. So it's a very, very important joint, like you said. So let's go to treatment now. How can it be treated? Or maybe let's start with diagnosis. There can be other things that affect the shoulder that is not frozen shoulder.
Yes.
So getting a good diagnosis, of course, it means going to see a good physiotherapist or something.
The first thing to know about diagnosis is your physical examination. When I see your shoulder joint, I tell you, move your hand up, the flexion, and you can't move it to this level. Even if I try to move it for you, and it's still not moving past that level, that's one of the first diagnoses. And I tell you to do, there's something we call external rotation of the shoulder joint. Okay. My hand is like this, I try to move it this way, and there's problem doing it. That's a diagnosis. Then to rule out other ailments, we can do X-rays and MRI. Because not only frozen shoulder can cause stiffness of the shoulder joint, as I said. You can have injury on your shoulder joints. You can have dislocation. You can have ligament tear. You can have tendinitis. So, but frozen shoulder, the first diagnostic tool for frozen shoulder is physical examination.
Okay, all right.
Then, and that's three phases. The first phase is actually the freezing phase. The freezing phase is the painful part of the phase, the painful phase of the injury. It lasts for like 4 to 6 weeks. It's always just painful, serious pain, and the pain is more at night.
Why so?
Because when your body is calm, you're in a calm position, the pain triggers more at night. And probably you've done a lot of stressful activity during the day. So at night, so when you're relaxed, the pain is actually more. Sometimes the pain even wakes you up at night. That's the first phase. The second phase is actually the frozen phase. That is, okay, now the pain is down, now there's restriction of movement. Is now actually frozen.
Frozen, okay.
Then the last phase, actually the towering phase, it is now resolving. Now the pain is down, the movement is now better. And treatment actually can last for more than 2 years. It's not an easy thing to resolve a frozen shoulder. But the major treatment for frozen shoulder is actually pain relief first.
Pain relief, okay.
When you cannot move a joint when your joint is painful. If I tell you that, okay, let me move your joint and move, you want to even bite in that.
True.
It's painful.
Painful.
So reduction of pain movement of
What kind of
pain.
medication, injection-wise, or the oral medication?
Oral medication is fine. The NSAIDs, they are called non-steroidal anti-inflammatory disease drugs, just to relieve the inflammation around the joint.
Okay.
Then when the pain is down, the next phase is now you do range of motion exercises. That is where the physiotherapy comes in. Because what we do is actually we make sure that you move your joints in all range of motion. Now you can use your unaffected hand to even to assist your affected hand.
Okay.
I can tell you, okay, probably when you're having difficulty in putting your hand at your back like this, maybe when you want to have your bath, your hand can't go to your back. You can do some exercises by yourself. You can use a long stick or a long brush or a long towel. Just use this hand to support it here, then you pull. So when you're using this other hand, the strong hand, to support, to increase the range of motion, it's actually another exercise you can do. Then the next phase of rehabilitation is strengthening. When you're able to achieve range of motion exercises, the next thing is for you to strengthen the muscles and the muscles around the joint.
Around that joint.
Then with that, I think that is okay. Then the next phase, probably they can go for manipulation. When it's not going, they can go for serious manipulation when you're under anesthesia, or they can even go for surgery. How do you,
I know this is something that you've met people that maybe they come to you after maybe they've gone to a traditional bone healer or something when they have this kind of issues. Well, what is your take on situations where people, maybe they have those things and then they go to traditional bone healers before, or traditional doctors, as it were, traditional medicine, instead of orthodox, as it were? How would, in situations like this, how would you, because at times maybe you could make the situation worse, as it were. So what's your take on?
Personally, I really don't have any problem with traditional bone setters, but the issue I'm just having is that for any medical condition, proper diagnosis is required.
Okay.
The proper diagnosis will give you the direct way where you're going to. Most people they just use idea that, it has happened to somebody before. We did this one, we tried to do like this, we tried to do like this, we tried to do that. And it's not always, all conditions are not the same. So when you have a proper diagnosis, okay, this is what is wrong, this is the movement, this is the treatment of what to be done, there is no problem with that.
Wonderful, wonderful. Thank you, Doctor. It's always a pleasure having you on the show, and I know that this is something people would have learned quite a lot from.
Yes, thank you very much.
All right, okay, that's it. Hope you're able to pick up something from there. But like I always say, the first thing, and like doctors always said, diagnosis. Ensure you go talk to a physiotherapist, and then they should exactly diagnose what is wrong with you.